Why don't we go ahead and start? First of all, thank you for coming to our information night about our learning abroad programs. What I'd like to do, first of all, is for students that are interested in going on one of the programs, here are the slips for the drawing. We have a few prizes that we're giving away. The most notable at the end of the evening is a $500 scholarship towards one of the programs. So, if you're a student and going to go on the program, thinking about it, fill out a slip. We'll collect it in the hat in a moment. Take one, pass it around, and at the end of the meeting, we'll have a drawing for a number of trinkets from Ghana that I just brought home, and the scholarship. So, as the slips of paper are going around, let me introduce myself. My name is Scott Benson. I'm an assistant professor here in the Division of Public Health and Infectious Disease Physician over in the hospital. I'm the director of the Office of Global Public Health here and oversee the learning abroad opportunities here within the division. I have the fantastic opportunity to work with Dickerson in Ghana, and I lead the Peru Learning Abroad program as well. Our programs, we're going to talk about each one of them over the course of about the next hour, so that you can get a little bit more information and have opportunities to ask questions about our specific programs, what we do, where we go, how we work, and find out which ones you're interested in. We will be around a little bit after to answer questions if you have questions that you want to come up and ask us individually, or just shout it out in the middle of the presentation. What I'd like to do, though, is start by briefly touching upon kind of the philosophy of the program and why our approach we call a different approach to making a difference. So this slide is a very telling slide, and I'm going to adjust the lights a little bit because I hate the fluorescent lights. This really is kind of symbolic of our approach, because this is who we are. Dr. Alder here represents us as the University of Utah. This is Chief Nana Tabri, one of the community chiefs in the communities that we work. This is Dr. Daniel Anson, a pediatrician and lecturer at the Confanoche Teaching Hospital and at the Kwame Nkrumah University of Science and Technology. Our approach is to work with our colleagues in country on an academic level, so faculty to faculty, to engage students who aren't seen in this picture, I know, to actually have an opportunity to experience, to do research that's driven in cooperation with the community. So the community has the ability to give us ideas on what their concerns are and what research they would like to see. We as faculty go around and figure out how to do it in a scholarly way to develop new ideas, new concepts, new understandings, and help students conduct that research. So we produce new knowledge. We do that by doing community assessments. We look at health systems. We look at sometimes very specific questions. Micronutrients in Ghana is a study that we have going on right now. We've done environmental health studies where we've found carbapenem-resistant organisms in drinking water. And we have gender equity activities and research that goes on. We have knowledge reproduction. In other words, teaching concepts that we already know. We have skill building. We work with students to help broaden their experience, to give them an additional skill set that they can take to an employer and provide services. We have graduate and undergraduate programs that help build experience and understanding of global health and of research practice. We also have, as far as our educational activities that go on, we have the grand rounds, we have coursework, We have our learning abroad, which we're talking about here. We have a graduate certificate, work with the Honors College, and we figure that we've had over 70 various forms of presentations, publications come out of the Learning Abroad Center program over the past 5 to 10 years. Finally, we have knowledge implementation, and this is where we take the things that we've learned, the ideas we've taught, and we put them into practice. We help the communities to put into practice the things that we've done. Now, we recognize that Utah is part of the globe. And so in putting things in practice, our practice is in capacity building. We have programs here in Utah where we take the things learned in Ghana and bring them back home. We take ideas developed in Utah and take them to Ghana. We built toilet facilities in Ghana. We have healthy families initiatives, CHIP campaigns. We have water and sanitation and hygiene campaigns in Ghana and India. I don't have Peru's listed up here because I'm going to describe them in a little bit. Our programs, briefly, what I'm going to do is I'm going to let Laura Stephens start on her experience in Armenia, give a little bit of detail about what their program has been doing. Then Ty Dickerson is going to take the next few minutes and talk about the program in Ghana. And then I'll take the last few minutes and talk about Peru. Now, we normally do have programs in China and India. However, due to some family issues with one faculty member, we're not going to China this year. And India, we just today had to pull the plug. And so if you're here specifically for India, we tried to notify everybody beforehand. But please consider one of the other programs. And we apologize if your heart was set on India. But due to some resource constraints and the fact that the programs just weren't developing quickly enough to happen this summer, we've actually had to roll back our India program until next year. So we've put it on hiatus until 2015. But the plan is still to go forward with those. So with that, I'm going to turn it over to Laura and let her present a little bit about the Armenia work that she has done and that they expect to do this coming year. Yeah, it's recording. It's recording for ulterior motives. Just forward and just forward back there. Okay. You have a video or something right there.
Oh, okay. Ah, there we go.
All right, hi, my name is Laura Stephens. I'm a second-year pharmacy student here at the University of Utah, and today I'm just going to tell you a little bit about the Armenia Global Health Program. So as you have noticed, I'm not Dr. Wright. She had an emergency come up last night, and she couldn't be here, but she's definitely interested to hear your questions, and I'll give you some contact information at the end. So these are the dates that we have for the Armenia program this year up front. So it'll be May 24th through June 13th. So just a little about Armenia for those of you who may not be that familiar with it. It's located just right here. It's a teeny little country surrounded by Georgia, Turkey, Azerbaijan, and it is officially part of Western Europe. But upon going there, you'll notice there's kind of a lot of influence, Middle Eastern influence in their culture. It's a very unique place to visit. And it also has a very rich history, so it's very old. It is the oldest Christian nation in the world, so they have a very rich religious background in that. It is a developing country, so one thing why it's actually really interesting to go work there is they often have situations where they'll get health programs going there, but when they run out of money, the programs end and people have nothing. So our goal in going there was to sort of learn what the people know, particularly about diabetes, and then find ways that we can sort of empower them to, you know, take care of themselves to some extent, and then also help their healthcare system. But kind of what we did. So I went to Armenia last year, and had it was a really enriching experience for me. And I just kind of want to go through some of the facets of this program. So our goal over there is type 2 diabetes, and there were two parts to this. One was research, and then one was outreach. So the research portion I'll talk about a little bit first. Our goal was to learn just sort of the general population's understanding about type 2 diabetes. And we decided to do this through a survey that we designed, that the students designed, and that the students tested in order to take this over to Armenia. So there's some really great aspects to this for people who are interested in going into the research in their careers or just learning more about public health. So we all had to get IRB certified, and many of us were involved in writing the actual proposal, the IRB proposal, to get this research approved. There's opportunities to learn coding for research. The survey preparation, so this involved, writing out the questions, making sure that they made sense, testing this on ourselves and on other members of the healthcare community, and then actually doing the survey in Armenia. This involved working with a translator, which some people haven't done before, and learning that skill is something extremely valuable to me as a pharmacist, and maybe to you in whatever career you go into. Data analysis, we learned that. You have tons of opportunities to publish. So at this point, since coming back from our trip, we already have 5 abstracts submitted. We're working on 2 papers currently, and then the rest are presentations at different conferences throughout the world. So this is it was a very productive and a great learning opportunity for me to do this type of research. So the other aspect of what we did out there was outreach. We wanted to sort of educate or give people the opportunities to learn more about type 2 diabetes in the community. So what we did was we had 4 health fairs that we designed and set up at 4 hospitals in Armenia. And one part of it was we designed these handouts. As you can see, they're translated into Armenian, but one was BMI, kind of going through with them, understanding what that is. That's a new concept for them. That's not something that they use in their country. Some exercises they can do at home, new dietary recommendations that we use in the U.S., kind of bringing that over there. So just teaching them appropriate portion size and how to handle carbs when you are diabetic or pre-diabetic, and then a little bit about hypertension. And so we were able to communicate with people, take their blood pressures, take measurements on them, kind of make them aware, if they should be getting checked for diabetes or how they can manage the diabetes that they already have. The other aspect of this was we also, I had the opportunity, and Paul here also went to make presentations to give 1 to the general population and then 2 to actually give to all the healthcare professionals in the hospitals there about type 2 diabetes, our standards in the U.S., and then learning from them what their standards are, how they treat it, what things they look for. So we were there to provide a service to them, but it was also a huge learning opportunity for us to kind of understand their healthcare system and what things they do differently, what works, what doesn't work for them. So when we were there, we also had a ton of fun. So Armenia prior to hearing about this trip, but it is just a great place to go. So they have tons of these monasteries and really old churches that we visited. We got to participate in some Armenian customs. They like to crawl through this rock and make wishes. So if you don't get stuck, then your wish comes true or something like that. We learned a little bit about Armenian genocide. We've all heard about the Holocaust, but Armenian genocide was before that and just equally as awful. So, we got a huge history lesson, tons of fun, tried new foods. We visited almost the entire country. It is small, but really beautiful sights, the mountains, that sort of thing. So it was a really enriching trip for me. And yeah. So these are, I think, everybody who went on the trip, and then also some of our collaborators in Armenia. We worked with their, so IPFSF is the International Pharmaceutical Students Federation, big mouthful, but we worked with the Armenian IPFSF over there, and it was really great for us because we could do a lot of our prep at Yerevan Medical University, and they served as our translators. We had many opportunities to meet the Minister of Health. We met with their dean, a lot of really important people, and we got on the Armenian news, so that was kind of exciting too. But yeah, so that in a nutshell is kind of what the program was. Dr. Wright, again, is really sorry she can't be here, but please take down her email address if you have further questions. There's a couple of us, Jonathan, Paul, and I, who went on the trip last year. If you have any questions afterwards, we'd be more than happy to attempt to answer those for you. And there's also this Global Health Armenia website that has a lot of pictures and reflections from the trip from students. There's some videos on there of what we did, and feel free to check that out if you're interested in all in going to Armenia.
I think there's also this year talk about expanding into Georgia, the northern country.
Yes.
Some of us went to Georgia on our own as an excursion, and it's an amazing place.
Yeah.
Really, really great. So hopefully that will.
Yeah. So our goals, so our goals this year are just kind of extend this diabetes research, look for new opportunities such as in Georgia and other places in Armenia to go to.
2 trips in 1. 2 countries in 1.
2 really awesome trips in 1. Yeah.
Is that when they extended the stay? Last year it was 2 weeks, but
I am not quite sure why they extended the stay. Is that more? Okay. There you go. Yeah. And more time in country. I could have spent more time there too. So. Are there any other immediate questions, or we'll be around afterwards as well?
If you can crawl through the wall, does that mean that you have a healthy body mass index?
Oh, yeah, we should work that into our activities. That's a good idea. Yeah. No, it's more about wishes, but yeah. No, it was really fun. I believe it's the same for all the global health programs. I think they're going to give you the website here, but I know you need to write an essay, I think, of your intent, and there's a $500 fee up front. I think you want to, for all these programs, you want to get your application in as soon as possible because they need to know how many people are going and start budgeting and that sort of thing. So if you're interested, you can start it, and the payment, I think, is the last thing you do, so at least get it going for that reason. She never has, actually. I don't know that they've got to that point, but she never has had a cap. So
in theory, there is a cap.
Yeah. Okay.
However, we have been able to expand programs if we have enough interest to frequently raise that cap. So if it's 1 or 2 students, we kind of squeeze them in. If it's a dozen, what we do is bring another faculty member or assistant along to make the program functioning with the appropriate amount of supervision. So yes, there are caps, but if there's enough student interest, we absolutely were willing to work around that cap to make it.
Okay, well, I'll be around afterwards.
You
And
stick around.
Paul and Jonathan as well. So
Any of us will be able to answer questions about Armenia.
yeah, and feel free to email Dr. Wright. She'd love to hear from you. Thank you.
Thank you.
Oh.
Kept it on all night.
I know, and sometimes you end up in places with the microphone on that. All right. So, questions on Armenia before we briefly move on? Those of you that came in late, make sure you get the little slip of paper if you're a student, because that little slip of paper is the key for the drawing for the scholarship. And so if you don't fill out the piece of paper, you don't get a chance at the scholarship. So get that piece of paper filled out. And if anybody else comes in, Grant, if you want to just catch people as they come in, if anybody new comes in, and make sure they get that. All right, next, we're going to talk, Ah, okay, I just didn't see the title. Ty, let me introduce Dr. Dickerson. He's a pediatrician up here at the University of Utah in Primary Children's, and he leads one of the directors of our Ghana program, and has been doing it for 7 years? 6
This will
years.
be five, I believe.
Okay, as Dr. Benson said, I'm Ty. I am a pediatrician. I take care of hospitalized children at the Primary Children's Hospital here. I'm a faculty member at the University of Utah Department of Pediatrics, but also the Division of Public Health. I have a master's degree in public health as well. And besides taking care of children, global health is a very strong interest of mine, both research-wise and education. 5 years, the last 3 years with Dr. Benson as well, and am a big advocate of both learning abroad, but also Africa in general, and West Africa in particular. Here you have a few scenes from rural Ghana, the area where we work, a reception, a swimming hole and washing hole, and then a latrine, as you can see here. And sanitation and hygiene is one of our big focuses, hence that picture. We've done a lot of neat things in Ghana, not only over the last 5 years, but over the last 10 years. A variety of University of Utah faculty have participated in quality improvement projects in the local teaching hospital in Kumasi, the second largest city in Ghana. We've done a lot of community development. We've done health worker training, and we have built things such as schools, such as this environmentally friendly latrine near a school for 300 children who were previously urinating and defecating in the bush right outside the school. Another picture of the latrine and Chief Nana Tabiri commissioning that latrine. So we teach things, we learn things, and sometimes we build things. As Dr. Benson mentioned earlier, there are 4 cornerstones to our collaborative there called the Barakuma Collaborative Community Development Project. And those cornerstones are: 1, University of Utah School of Medicine faculty and students. The second cornerstone is our cooperation with local academia, the Kwame Nkrumah University of Science and Technology, as well as the Konfanoche Teaching Hospital. We collaborate with community members under the auspices of the Chief Nana Tabiri, as well as other traditional and political leaders in the area. And then finally, the community itself. We collaborate with and cooperate with, and select community members have a role in helping us determine the priorities for projects, for education, for training. We build capacity not only in the community, but with local students, just like yourselves in Ghana. And we'll talk about that a little bit more. And all of our projects, we aspire to be scalable, meaning what we learn, what we do, we hope is done in a manner that we can learn from that, apply the lessons learned to our next project, and hopefully slowly but surely expand. This is a group of students who were involved in a health promotion activity. Whenever we do research in Ghana, we try to use what we call good community-based participatory research practices. We believe it's important to develop generalizable knowledge, to learn things that you can share with the world. But we also think that too often community members themselves are often not the recipient of that knowledge generated during research. So every year we go back and we have a project that's really fun, getting out in the community and actually educating the community members regarding the outcomes of our research. One example was that 2 years ago we did a high blood pressure, hypertension screening project in the community. We were flabbergasted to learn that rates of hypertension in adults above the age of 35 approached 50%. About 1 in 2 adults had clinical hypertension. So there's an epidemic right underneath our noses that we didn't know about. They do have the means to diagnose and treat hypertension among adults locally, and that's very fortunate. But oftentimes there's a disconnect between the resources and services that are available in communities and actually knowing that they're there and understanding how to access such resources. So this health promotion team goes out and spreads the word. We talk about hypertension, how it's diagnosed, some of the adverse effects of hypertension, and what people can do about it. The SOAP is something that we leave behind in every household, and it's kind of a thank you for community members giving us some of their time. This is a women's participatory group, and I believe, yes, this was understanding the micronutrition needs and where micronutrients come in local diets. A different approach to making a difference. And one of the things that's different about this program and that I really laud and really enjoy is the fact that in Ghana, typically, every student team is paired up with medical students from the local teaching college. So not only do they help us navigate the culture and the geography, but just like in Armenia, they are experts in local language, which is called Twi, although English is the national language. It was a former British colony. But you can see there's a mixture of University of Utah students here and Ghanaian students. And a lot of friendships are formed, and it's just a good camaraderie. We learn from each other. Not to mention that if you want to go out and get good prices in the market and that sort of thing, you better take a Ghanaian with you, and they're happy to do so. In 2014, we are leading another group of students on a variety of projects. This will be in July. I'm not sure if the dates are they up there, Scott? Approximately just after the 4th of July is when we typically leave. And 5th through the 27th.
So on the ground, July 6th.
Got it. Got it. That's right. We need 21 days total for you to be eligible for scholarships, and really to get any meaningful work done, you need 3 weeks in the field. We can't work you every single day as much as we would like to because you need downtime, especially when doing this kind of work in a tropical environment in a foreign country. So we build in some downtime as well, but you do work hard. This is actually a scene from the last few days. We go to the Cape Coast on the Atlantic Ocean and spend a few days decompressing and learning some additional things. Ghana, on the coast of West Africa, between Togo, Ivory Coast, Burkina Faso, Benin, and population is approximately 20 million for the nation. Kumasi, the second largest city is approximately 2 million. It's the location of the Ashanti Empire, known as fierce warriors historically in West Africa. Lots of health issues in Ghana. It is not a basket case by any means. It has largely escaped the HIV/AIDS epidemic that has racked a lot of the southern half of the continent. And economically, they're doing better than many African nations. However, many health issues, undernutrition, lots of infectious diseases, TB, malaria, for instance, are still very prevalent. One of the leading causes of death in children in Ghana is malaria. Medical care quality and access are issues. Sanitation, hygiene, chronic disease such as hypertension and child mortality is an area we have focused on quite a lot. We do not work in an urban setting, so to speak. We're not in Kumasi City, and for good reason. We know, as a pediatrician, I speak about children a lot, but we know that rural children and children in the lower quintiles of household income have far higher rates of morbidity and mortality as compared to urban children. We like working in the rural areas outside of Kumasi for those reasons. It seems that's where the most help is needed. Some of these are a little bit dated, but it gives you an idea about the variety of projects that we have undertaken. This year, preliminarily, I do want to say that we have something for everyone as well. Even though I'm a physician, as is Scott, this is not all about clinical medicine. So if you're not a PA or an RN or a pharmacist or a medical student, that's okay. We have things for you to do that are meaningful and have a significant impact. It is a great way for students who are still not sure what they want to do with their career to explore a variety of career options just by watching others in action, from nursing, from public health, social work, economics, and business as well. And this year, I believe we will have one economic development project. We will have a health worker training project. And there are 2 pediatric residents that are going along that are going to help us with that. We will do our health promotion and education outreach. And that's a wonderful project. If you're not really sure that you're interested in clinical work, you want to go over, meet people, go into homes, hear about their lives, their struggles, their perspectives on health. So there are offerings for everyone. Days in the field are typically long. We get up and start early, 7, 8 o'clock in the morning, and days often go till 5. It doesn't sound like a long day, but it really is when you're out there in the hot sun. This is Stephen a few years ago, and we worked him into submission there. He's passed out on a diesel storage tank. The people are beautiful and receptive. The children can't wait to see you, can't wait to meet you, and you will have your own little personal entourage of children every day. But this is Ryan and Adrian, a medical student and a nursing student, doing a survey about child mortality. This gentleman's making, I believe, the local delicacy, which is fufu, a cassava-based staple food. Daisy Krakowiak Red is one of our former MPH students, and another student from Emory University that we're looking at reproductive health issues among women, access to oral contraception, their understanding about family planning. And yeah, her paper was published in a peer-reviewed journal. So for those of you that are real go-getters, interested in a research experience, that sort of thing, if your contribution is sufficient and we can make that happen, a lot of it depends on you, there are opportunities for scholarly publications and that sort of thing that look really good on applications for graduate schools and on your resume in general. But we don't just work. As I said, we go to the Cape Coast, and this is a nice scene from the coast. For some R&R, a fishing village. This is a slave castle. Ghana has a dark side to its history. The Asante were responsible for capturing a lot of Africans from the interior of the subcontinent, bringing them to the coast and selling them to the British, the Portuguese, the Dutch, the French, and they've got a series of old, now fortunately defunct slave forts that are sombering and a very good history lesson. Visit this oldest mud brick mosque in West Africa, and of course you can't go to Africa without seeing an elephant, I don't think, but there is a game reserve, and the last remaining forest elephants in West Africa are in this game reserve in Ghana, and that's one of our weekend excursions. And then of course there's Kumasi city itself, which is fascinating. The largest open-air market in West Africa. So if you want to learn how to bargain and get humbled regarding your bargaining skills, that's the place to go. And you can contact either myself or Dr. Benson about this opportunity, and especially if you want more specifics. What project would be right for me? What's the environment like? How can I prepare? These are the sort of questions that we're happy to entertain. And should I take a few questions right now on Ghana specifically, or either that, or we can chat afterwards. We're going to stay on for a little while. Great. Looks like a pretty good group this year. Maybe a couple dozen of us. So you'll have a lot of friends from home.
Hang on to the back of the tie for a minute, because we have a wrong. You want me to take yourself?
Oh, yeah. Thanks.
we have a fortunate opportunity here for a minute, and I want to take advantage of that. Ty mentioned a recently developed economic project that's just come about. So I was in Ghana last week. Historically, over the past few years, we had an economic development project where we helped local organization develop an agricultural co-op where they've grown corn, and now the citrus plants are maturing, where we've had one of the first successful business loans for a cooperative organization from a bank now being paid back to the bank. The model of economic development is such that the University of KNUST wants to continue this form of economic development. And so now we're looking at certain forms of food sales, specifically a food called kenke, that's a mixture of local products that's cooked by women over wood-burning fires, and the women are suffering pulmonary disease as a result of indoor cooking, excessive cooking over fire. It's also resulting in deforestation. So last week I met with one of the professors of agricultural economics at KNUST, and we're organizing a new economic development project that will look at organizing the women into a cooperative, purchasing propane stoves so that they can get an economy of scale to produce kenke in a cleaner environment and sell it at the same price as those who are using wood burning. And so that the women can have less of a smoke-filled house as a result of using propane instead of wood burning, hoping to alleviate some of the deforestation and some of the pulmonary disease. And that is, I'm going to give Brian Rivette credit for starting the economic development project in the citrus fields a number of years ago. He's continued and is now the one who has taken the lead on helping us to advance the kenke project. So I just wanted to recognize Brian, that he's done a fantastic job and given an example to the bank there of how one goes about administering a loan and actually getting paid back, which in some senses is a new concept in Ghana. So the bank is pleased. Brian.
Can I just add one or two quick things? The women who are selling the kenke, typically roadside, are often holding infants on their knee or in their arms, and those kids are being exposed to the smoke just as much as the women are. So this impact is going to help not only the sellers, but the other members of the cooperative, and certainly all the infants who are exposed as well. And then secondly, Scott's last point, I think, is probably the most significant in terms of the earlier economic development project that we did, which was to change the attitude of the banks towards loaning money. So the theme, if you will, is how to support entrepreneurship in an environment where often members of local communities have hoped for donations or a new building being built. Instead, now they are taking on their own projects, asking for loans, paying them back, and developing their own capacity. Hopefully they will put us out of business, we'll no longer be there, because these projects will just continue to grow. But we need to do projects in a variety of different areas. And one element of the Summers project is to look at building a business case for the propane gas heating units.
Correct. All right. With that, I'm going to move on. Thanks, Brian. I'm going to talk a little bit about Peru, our final program for this year. Now, I have myself listed with Dr. Rosado. Usually, we offer two different programs in Peru, one over the medical student spring break. However, this year, not enough individuals were interested, so we didn't do that program. In Peru, our trip is in June, June 7th through 29th. Our partners, us, the Division of Public Health, and the University of Cesar Vallejo. Now, Cesar Vallejo is Poet Laureate, Nobel Prize winner from the region in Peru. It's a private university with a medical school, and their training in community health is in collaboration with the University of Utah. Trujillo, Peru is the city known as the City of Eternal Spring. It's just kind of on the north coast. Just north of Trujillo is a little town called Juanchaco, which is the surfing capital of South America. And usually we finish with enough time in a couple of afternoons and weekends that people go out and take surfing lessons. And so you can go rent a wetsuit and a surfboard, rinse out the wetsuit really well before you go warm it up for yourself. Go hit some waves, catch some sun, ride horses on the beach in Peru. Now, the other glorious thing about Peru is the temperature's almost always 65 to 85, with just about 20% humidity to 40%. Really comfortable. And the interesting thing about Peru, in contrast to Armenia and Ghana, Peru, for lack of a better term, is a country with both very developed regions. In Lima, you have first world medicine. You have developing foodies. You have ceviche restaurants. And yet just blocks away, you'll have lack of sanitation, lack of running water, drug-resistant tuberculosis within blocks of each other. So Peru is on the edge of both the developed and the developing world, which poses an interesting set of problems. How do you address problems of chronic disease in populations that are now overcome infectious diseases, pneumonia through vaccinations? You know, malaria is not the case on the coast. So a lot of historically, they've been able, through water and sanitation improvements, to improve to the point of not having those diseases, and yet in the same population just a mile away, you have diphtheria, you have diarrhea, you have malnutrition. And yet they're using the same infrastructure. So what we do is we look at, in the spring, we look at primarily medical care, because it's a medical program. In the summer, we're back in our community-based research expertise, where our research projects are the University of Cesar Vallejo. We work in an area called Victor Larco, which is one of the communities where, traditionally, they've made shoes. So in the United States or in China, there's a large shoe factory. And you go to the Nike shoe factory and you see 400 little kids gluing the soles on the shoes that you're buying for $70, $80, $90, $120 at Foot Locker. In Peru, the shoemakers are individual. They go and they buy 30 soles, and they sew 30 pieces of leather onto 30 soles, and then they sell it to somebody else, and somebody else glues on the next piece, and somebody else glues on the next piece, and somebody else puts the laces in, and then they sell the shoe at the end. And so you have individuals with chemical exposures at the household level. And yet these individuals are now making enough money where they still don't have running water and sanitation, but there's a McDonald's down the street. And where they used to live on food that was at the local market, and they'd have to walk down to the local market and buy their platanos and buy the rice and buy the beans and buy the chicken, now it's just as easy to walk down to McDonald's and grab a Big Mac. So you have individuals that are not only living in an environment where you have water and sanitation issues and communicable disease, but you're also now starting to see issues of chronic disease, of sedentary lifestyles in the same population. So last year what we did is we looked at cardiovascular risk assessment in this population. We said if you take individuals who are living on this border, on this interface of, for lack of better terms, developed and developing world, and look at their cardiovascular risk, what do you find? So we looked at their blood pressure, we looked at the presence of diabetes, we looked at their cholesterol. And what we found is a number of people had an elevated total cholesterol, which said they're at risk for cardiovascular disease. But when you look closely at the numbers, actually that elevated risk of cardiovascular disease was frequently because of an elevated good cholesterol beyond what you see in America. In America, your HDL, or good cholesterol, if you get it up to 40, you're doing pretty good. Some of these guys, their HDL, and so their total cholesterol is falsely elevated. Well, it's elevated, but due more to good cholesterol rather than bad cholesterol. But our predictive models that we use in the United States don't necessarily take that into account. And so it may still predict an elevated risk of cardiovascular risk in this population, even though it doesn't exist. So that was our screening project last year. So this year we're going back to do a more comprehensive exam of the same population, looking at a complete profile, and then proposing a longer term over the decade study looking at coronary cardiovascular disease, coronary artery disease, so that we can then describe, is the Framingham risk calculation appropriate for developing areas? That will be a brand new concept. Of course, then we also have opportunities to go out and to do cultural excursions around Peru. Within just a few minutes drive, you have 5 different cultures. You have the Spanish, you have the Inca, you have the Moche, you have the Chimu, and you have somebody else that all of a sudden I'm drawing a blank. We spend a little bit of time at the beach. These are old surfboards. If you hire a Peruvian, he'll take you out and let you ride the waves. I think they're called a little cow, and they'll take you for a ride. We visit the hospital so that we understand the health care, have a little opportunity to work in some of the clinics so that you can see both the scale of the private hospital, the Social Security hospital, which is for those on salaries, and then the public hospitals. And then, of course, unlike Ghana, where you have the opportunity every weekend to go somewhere, in Peru we're a little bit more isolated. So we work hard for the first 2 weeks, really in Trujillo without going anywhere. And then instead of taking a lot of little weekend excursions, what we do is we spend the last 5 days going down to Cusco, going down the Sacred Valley, finishing at Machu Picchu, climbing up at about 5 o'clock in the morning to watch the sun come up, watch the clouds part, having the spiritual, life-changing experience at one of the 7 new wonders of the world. Then we spend a day in Lima and come back to the United States after a life-changing experience. So, 3 fantastic opportunities. I do think that they're excellent opportunities for learning about global health, learning about yourself and opportunities. And they're not just for physicians. Some of our best students last year was actually a history major who's going to law school. And she did a fantastic job. However, one of the keys to having an excellent learning abroad experience is the preparation beforehand. And previously, we'd allow each trip director to do their own preparation, and we found that as trip directors, we were often duplicating what the other one was doing. So this year, we came up with a new experiment. Traditionally, a learning abroad experience has been 4 credit hours. And then we kind of prepped you before, and we asked you to come on Thursday nights and spend a couple hours talking about specifics about Ghana, or about India, or about Peru, or about Armenia, and doing some readings and getting well-versed. And those that participated were much more effective in their work, and they learned more and had a better experience abroad. So this year what we did is we've organized it into actually a class the second block of spring semester. Now, you have 2 options. You can still sign up for a 4-hour research or a 4-hour learning abroad program and go with us without being prepared and have a great time. Or you attend a class, the second block. We will teach you how one does global health, how one does research. We will have small breakout groups where you learn about Ghana, or about Peru, or about Armenia. And then you can take those skills and ideas that you learned in class so that when you hit the ground in whatever your destination is, you are already leaps and bounds ahead of those who have not taken the class. The other thing is we've priced this class so that there's a 4 credit hour option and the 5 credit hour option. It's actually half the price difference than if you were to take it as a 1 credit hour just as a graduate or undergraduate student. So you're actually getting a really good deal for an extra credit hour. You're only having to pay half price for that extra hour of credit, and you're getting prepared for the experience. Now that class is taught by Ty, who has successfully taught that class last year and organized the groups for the past 5 years. So Ty does a fantastic job, and he brings in all sorts of guest speakers and wonderful documentation and everything. So I would encourage you to at least think about, if you're going to go on one of our programs, consider the 5 credit hour option, get that half price extra credit hour, and be more well prepared for a career and for your opportunity in learning abroad. Now, all of that being said, I'm now going to turn some time over to the Learning Abroad office and let them talk about some of the things why you're really all here. You want to know how to pay for it. And so Brianne's going to talk about, and who did you bring with you?
Jenna. She is actually going to be the coordinator of these programs.
Okay, great.
So she just started last Thursday, but she has a lot of experience already on learning abroad, so she'll be a really good resource for you guys. Okay, so I have some flyers up here. We also have flyers for all of the programs.
Okay, so I'm going to make you take the microphone.
Am I not talking loud enough? I apologize.
Well, it's actually being recorded so that if somebody's not here tonight and they want to know more in the future, they can.
No, no pressure, guys. Okay, so we have all the program flyers up here. I'm just going to hold this right now. And then Jenna is passing around the scholarship information. So there are certain scholarships specifically for these programs, which is a really big advantage for you guys if you're thinking about doing one of these programs over another learning abroad program, because there is money that will go specifically towards these programs, which increases your chances of being able to fund your learning abroad program. The other great thing about these learning abroad programs is the price per credit hour is a little bit different than if you're paying regular tuition. So it really is a good deal for the kind of experience that you're getting and the kind of educational experience that you're getting as well. In addition to that, there are a couple of other scholarship opportunities that I want to make you aware of. The first is kind of not something that you would initially expect. So if you watch this really awesome video right here, which I may or may not have made, we don't have to watch the whole thing, but it will just, if you go down to the link down there, it will bring you to our Learning Abroad Fair. Perfect. Oh, we're gonna watch it. This is happening. There's supposed to be really fun music in the background, but okay, perfect. So we are having a Learning Abroad Fair next Tuesday, January 28th, and I'm not sure if you saw it, it was kind of fast, but we are having a scholarship drawing at that fair. So we'll be giving away 2 student fees, $1,000 towards your Learning Abroad program. This is in conjunction kind of with our regular student fee scholarships as well. Those scholarships are open, and those are random drawing scholarships. So it will be the easiest scholarship application that you've ever filled out, and on these programs you would be eligible for $1,000 for that. So if you apply for Enter to Win our scholarship, which will be announced at the fair, and you enter to win the student fee scholarship, you're really doubling your chances of getting that scholarship money. The instructions are just on our website right there. Basically, you just have to like our Facebook page and fill out a form. There's always a catch, but it's a pretty easy one. So I would definitely recommend doing that. And then on the flyer that you have that will have the 2 scholarships on it, you already heard about the student fee scholarship. We also have a merit-based scholarship as well. That one you do have to write an essay. You need some recommendations for that. But also it's a pretty easy scholarship to fill out. And it's about a 1 in 4 chance of getting a scholarship towards the program. So the odds are very good for that. And then if you want to apply for these scholarships, you need to have started an application. Oh no. Started an application in the system. So that would just be, you can go to search programs, you can search any of these programs right in there and you can find it there. And from there you can see the scholarships tab at the top. And you can apply for all of these scholarships, including the scholarship through Global Public Health as well. So those are some really good opportunities. And also any financial aid or scholarships that you already have generally can be applied towards learning abroad programs as well. So do you have any questions about scholarships or application process, anything like that? Deadlines? No? Okay, and just keep in mind that $500 fee that you pay when you initially submit your application, that does go towards the entire program cost. It's not something that you tack on. It's something that will be deducted. And then you pay for the program just through your CIS account. So it's pretty straightforward. Yes?
Do you know what the tuition is going to be for the programs this summer?
What the tuition is? So the tuition is actually included in the program cost. It's part of that. So generally, it's $45 per credit for tuition. So it is reduced compared to what you might be used to paying. But all of our flyers that we have up here will have the program cost. So just keep in mind that will have things like lodging, tuition, health insurance. So it has a lot included in that price. Any other questions? Okay, we're just in Union 159. On the back of those flyers, it also has our information as well. So feel free to contact us, either myself or Jenna, and we'd be happy to answer any questions that you may have. They already saw the video, so that's pretty exciting. There you go. And make sure to come to the fair. We'll